Okay, I'm gonna talk about cutaneous leishmaniasis with a paranoid-like lesion. Leishmaniasis, also known as oriental sore, tropical sore, Chiclero ulcer, or Chiclero's ulcer, is the most common form of leishmaniasis affecting humans. It is a skin infection caused by a single-cell parasite that is transmitted by the bite of a phlebotomine sandfly. Okay, cutaneous leishmaniasis. This disease is considered to be a zoonosis, an infection disease that is naturally transmissible from vertebrate animals to humans. Cutaneous leishmaniasis. Here we will see a little video about this.
A 28-year-old man, his chief complaint came with severe pain over the elbow and dorsum of the foot. His clinical examination shows ulcerated plaque over the elbow and the dorsum of the foot. It started as a nodule that ulcerated. This photo shows ulcerated plaque over the dorsum of the right foot. And this photo shows ulcerated plaque on the right elbow. In microscopic examination, the epidermis, it shows hyperkeratosis and focal pseudoepitheliomatous hyperplasia, while in dermis, it shows heavy mixed inflammatory infiltrate with few epithelioid granuloma without caseation necrosis, and multinucleated giant cell was seen. Numerous neutrophils, lymphocytes, plasma cells, and histiocytes were seen. H&E and Gimda section shows leishmania-like parasites within macrophages. Parasites were small round structures with eccentrically located kinetoplasm. This photo shows a previous infection of cutaneous leishmaniasis and it leaves a scar.
Okay, now. Paranoid lesion. Paranoid is an inflammation involving the lateral and proximal fingernail folds. Paranoid lesion. Predisposing factors include overzealous manicuring, nail biting, thumb sucking, diabetes mellitus, and occupation in which the hands are frequently immersed in water. Here we're gonna see a video about the paranoid lesion.
This is an abscess present over near the proximal nail fold. So below the skin, it is present near the matrix of the nail or near the root of the nail. And if you are going to train it, you will see the incision given and the pus will come out of the cavity.
Okay, disgusting. Leishmaniasis cutaneous. CL, leishmaniasis cutaneous leishmaniasis, is characterized by skin lesions open or closed, which typically develop within several weeks or months after exposure. In some people, the sores first appear months or years later, in context of trauma such as skin wounds or surgery. Cutaneous leishmaniasis with paranoid lesion. They typically progress from the mild puffles to nodal plaques, and eventually lead to open sores with a raised border and a central crater. Ulcer, which can be covered with scales or crust. Paranoid, here we're going to see the last video.
Paronychia. Paronychia is an infection of the nail fold, usually caused by Staphylococcus, especially in the acute setting, or Candida albicans in the chronic setting. It may be caused by herpes simplex, which is called whitlow. It presents with a cellulitis, which is inflammation of the subcutaneous tissue, then pus around the nail fold, which may look like vesicle or bullae with crusting in the case of herpetic whitlow. Treatment of the acute paronychia is surgical drainage, and we should send swabs for culture and sensitivity, soak the wound with saline, introduce systemic antibiotics, and elevate the finger. In the chronic situation, it may require excision of the crescent of the eponychium Also, we send swabs or scrapings for culture and apply appropriate topical antifungal agents. In the case of herpetic paronychia, we are advised to avoid surgical drainage because of the risk of secondary bacterial contamination that will ensue. We can see in this picture a case of acute paronychia. We can see the collection of pus underneath the nape.
Thank you.